So today I'm going to talk about clonazepam, which is the generic form of Klonopin, which I'm sure you've all heard of. So Klonopin is an allosteric agonist at the GABA A receptor, so it's a benzodiazepine. And as I'm sure you all know, but just as a reminder, this is the GABA A receptor. It has 5 subunits. The alpha subunit has a histidine residue, which has very high affinity for benzos, so they bind right here in the pocket between the alpha and the gamma subunits. And then, a conformational change is induced and chloride can rush into the cell to make it less excitable. So what is Klonopin? Klonopin is a type of benzodiazepine tranquilizer, which is a type of central nervous system depressant, and all that means is that it slows brain activity. So other drugs of this class are hypnotics and sedatives, and they're very useful for treating anxiety and sleep disorders. Benzodiazepines can be administered in many different ways. They're lipophilic, so they can very quickly get into the brain. They're also very well absorbed by the GI tract. Importantly, they accumulate in lipid-rich areas like adipose tissue, and that can be problematic for long-term use, which I'm going to talk about a little later. Some generate active metabolites, but not Klonopin, so I'm not going to talk about that. Different benzos also have very different elimination half-lives. So short-acting benzos, they have a half-life of around 1 to 12 hours. For intermediate, it's around 12 to 40 hours, and for long-acting benzos, it's anywhere from 40 to 250 hours. So for a little history, the first benzo, which was Librium, hit the market in the early 50s, and soon after there were a couple of others as well, like Restoril or temazepam. These were low to medium potency and low toxicity, so they were readily prescribed for epilepsy, insomnia, and anxiety. But in the late 70s and early 80s, some high-potency benzos became available, and these are drugs like Xanax, Klonopin, and Ativan, and they have a much faster onset of action, and they started being prescribed for panic disorder, as well as adjuncts to SSRIs and antipsychotics. By 1983, there were 17 benzos on the market, and they're now prescribed for issues from panic attacks to weight control issues. Temazepam specifically was brought to the market in 1975, and it's one of these highly potent benzos, and it actually takes longer to metabolize than the other high potent benzos. Its half-life is 18 to 50 hours, so the idea was that people shouldn't have to take it as frequently and that it should only be for short-term use. It's both a GABA A and a serotonin agonist, and in 1983 it was shown to be at least as effective as lithium for treating acute mania. It also accelerates treatment response to panic disorder when it's taken with SSRIs, and it can be as effective as Xanax for treating panic disorders. Klonopin also has low lipid solubility compared to the other high-potency benzos, and it's thought that it's not as likely to cause anterograde amnesia, which is a problem with the other high-potency benzos, and I'll talk about that in a little while. Just to think a little bit about how benzos affect dopamine function, which I know that we spoke about in class, but just as a reminder, so benzos interact with the alpha-1 GABA A receptor, and in this figure you can see here there's 2 types of GABA A receptors. There's alpha-1 and alpha-3. The GABA receptors on the dopaminergic neurons are alpha-3 GABA A receptors, so benzos can't directly alter their functioning, but instead, which we talked about in class, they disinhibit the inhibitory GABA interneurons. So the interneurons have the alpha-1 receptors that the benzos can interact with and thereby lessen the restraint on the dopamine neurons so that they can fire more. So there are a lot of side effects. I'm definitely not going to go through them all, but I thought that I would include them in case anyone's interested. Some I find have intriguing implications that I want to focus on a little, 2 of which are problems with thinking and memory and cognitive impairment. So this idea of cognitive impairment, which I feel like you hear thrown around a lot, it's a broad term. It includes anterograde amnesia, sedation, drowsiness, motor impairment, inattentiveness, and ataxia, which is just when you can't control your body, your muscles. So the effect on Klonopin on memory is something I didn't really know that much about, but that I want to talk about a little. I'm not sure if you all remember your memory tree and the different types of memory, but we have short-term and long-term memory, and then different types of long-term memory. So there's declarative memories, which are the explicit types like episodes in your past or certain facts, semantic knowledge. And then there's non-declarative memories, and these are the more implicit types of memory, like associative learning or riding a bike, or the like priming effects in psychology. Benzodiazepines don't affect short-term memory, but they do affect long-term memory, and they affect declarative and non-declarative memory in different ways. For declarative memories, it only affects episodic memories, and the impairments occur earlier and they last longer. So they start pretty soon after drug administration and they last longer than the implicit memory impairments. But for the implicit, the non-declarative impairments, they coincide with the peak level of the drug and they don't last as long. So there's two hypotheses to explain this. The first is that these non-declarative memory impairments actually need this higher level of drug, and that's why that they occur at that time. Another hypothesis is that there's a certain type of receptor that's actually activated at this higher level of drug, and that's needed for these additional implicit memory impairments. So one of the dangers with this is that because benzos are eliminated so slowly from the body, they can build up over time and cause problems that weren't anticipated. So some typical symptoms of toxicity can appear over time instead of chronically. So you can be prescribed a normal dose, and then over time these side effects start happening that weren't happening at the beginning. And another concern with this is loss of inhibition, where the patient's perception of the risk of a certain situation is impaired. So the most common side effects of this are high-risk sexual behavior and reckless driving. A scary review found that after only a single dose of benzos or other similar substances, driving can be impaired and the effects can still be present after a week of not taking the drug, which is a little terrifying if you think about it. Benzodiazepines also have substantial interactions with other substances, so mixing them with opioids can be really dangerous, and there's lots of detrimental cardiovascular and respiratory effects that can be dose dependent too. Mixing with alcohol leads to this kind of synergistic effect on the central nervous system since they're both depressants and they both act at the GABA A receptor. So muscles can be slowed, blackouts are more likely, even unconsciousness or falling into a coma can be more likely. There's also this effect on the immune system that can also apparently lead to organ failure. So clearly, Klonopin is really dangerous to combine with other drugs, and frequently in deaths from overdose, Klonopin are one of the culprits. I looked up some celebrities who died from Klonopin overdoses. Margot Hemingway, who was an actress and a model, she died from a barbiturate and benzo cocktail. Don Simpson, who's a producer of many movies like Flashdance, he died from an unintended benzo overdose. More recently, Anna Nicole Smith died from mixing many drugs, one of which was Klonopin. David Foster Wallace, the author, he suffered from depression and hanged himself after being prescribed Klonopin, which of course doesn't mean they were necessarily related. There was also this incident where soldiers were dying in their sleep after having been prescribed Klonopin and Seroquel for PTSD. And Stevie Nicks famously became addicted to Klonopin after giving up harder drugs like cocaine, and she's spoken a lot about it and how difficult it was for her to stop taking it after. So an article published a few months ago in 2016 looked at CDC data for benzos from 1996 up to 2013, and they found that the number of adults filling prescriptions rose by 67% from 8 million to 13.5 million. The number of benzos being dispersed had more than tripled. The average amount that was being filled over a year increased by 140%. And in 2013, in the US, over 22,000 people died from an overdose that involved specifically prescription drugs, and 31% of those involved benzos. Another study found that over 36 million Americans were prescribed anti-anxiety drugs in 2013. And that includes over 700,000 people that were under the age of 5, 3 million people between the ages of 6 and 24, and over 30 million who were over 25 years old. So in total, over 20 million Americans were specifically taking benzos in 2013. So the last thing I'll talk about is the study that looked at the trends in different drugs for 8th graders, 10th graders, and seniors, high school seniors. And what I found interesting is that nearly 5% of high school seniors had tried benzos in the past year. And when you compare those numbers to Vicodin or OxyContin, which I feel like you hear about a little more as the sort of problem drugs being used in high schools, Vicodin was under 3% and Oxy was 3.4%. Okay, so that's all. I hope you learned something new about Klonopin. I know it's a super common drug, both to be prescribed and taken for fun. So I thought it'd be interesting to learn more about it. And I was definitely surprised about some of the things, and I hope you learned something. Have a great day. Bye.